is I'm going to start just by slipping my hands under here. I'm going to take a moment, make sure that her body feels like she can trust that I'm not just going to go to town. And I'm going to gently palpate. I'm going to just pick a hand, okay? And I'm going to kind of palpate around her occipital ridge, maybe just above it, just below it. Let me know. Tender, tight, ticklish, sore.
No.
Not too bad along there. Okay. I'm going to come just below your occipital ridge now. And I'm palpating kind of lateral to medial. Not too bad there. I'm going to go a little bit lower.
It seems like the discomfort's on this side.
Yeah. So I've kind of palpated just above, right along, and just below her occipital ridge. And I'm not finding a whole lot on this right side. Okay. Cool. Once in a while, people will surprise you, and they'll have a sore spot they don't even know about. All right, so just above the occipital ridge on that left side again, more lateral to medial, and right along that ridge.
Right in there.
Yeah, right in that neighborhood. And as I come more medial, it's not as bad when I go more medial, is it?
No.
At that midpoint there. All right, she's starting to make the frowny face now. All right, now if I go just below the occipital ridge.
Right there.
Kind of cranky there.
Mm-hmm.
Yeah. But yeah,
Yeah,
right?
that's it.
That's about the worst one there. Notice the facial expression change. Okay, so I've just got my fingertip resting right on that spot. The rest of my left hand is just kind of cradling her head. Okay, in kind of a comforting, you know, it's okay kind of way, right? So here's the deal. So now I'm just going to take my right hand. I'm just going to very gently rest my hand on the skin of her forehead. And now my fingers of my right hand are going to start to move towards the fingertip where the sore spot was. And what you're going to see is that if you look closely, you're going to see that the skin of her forehead shifts with my hand. Mm-hmm. And there's going to be a point at which her head starts to shift a little bit. That's the point where I pause because I've already taken a lot of slack. And I don't necessarily have to shift her skeletal structure much. When I press here now, is that still tender?
Not as much.
Okay, excellent. I'm going to try taking just a little bit more. Her head will rotate just a few more degrees. Again, her head doesn't turn very much at all. And when I press here now, how does that feel?
It's mostly gone.
Okay, cool. So I'm not going to change. When people say mostly gone, usually that tells me like hang out there a little longer, and we'll see if things calm down the rest of the way. Okay. I don't always get lucky enough to get rid of all of it right away. When I press here now, how does that feel?
Gone.
Okay, so she just needed a little bit more time. Cool. So how visually exciting is this?